The Fairbanks study came out some time ago, but now that it's been published by the CDC, it's giving researchers across the country and around the world a better picture on how pervasive the COVID-19 virus is and how deadly. Feeling pretty good about yourself because you don't think you've caught the coronavirus yet? An IU Fairbanks School of Public Health researcher says, think again.
It is certainly possible that people might be infected and not know about it. You might have already been infected and not have known about it.
The daily dashboard from the Indiana State Department of Health gives us raw numbers drawn from the population most likely to be impacted by COVID-19.
We know most about the disease based on people at the top of the pyramid, and not even all that are medically attended are tested, but it's still not capturing everyone who's symptomatic and asymptomatic but not getting tested or not going to the doctor. And this bottom of the pyramid, we had estimated to be about 10 times larger than the top of the pyramid.
If the State Department of Health reports almost 60,000 positive tests as of today, by the estimate of the Fairbanks study, there could be 600,000 infected Hoosiers. Right now, the Fairbanks study estimates there is a 1 in 172 chance of dying from the confirmed disease. This model from the Institute for Health Metrics and Evaluation shows the sharp uptick in positive cases in Indiana in the last month. The 7-day daily positive infection rate average statewide bottomed out in June at 4.9% of those tested, but has steadily climbed back up to 8% this past week. Same in Marion County, where that 7-day daily positive return rate dropped to 4.3% last month, but has bounced back up to 10.3% in the last 7 days, with the kids preparing to go back to school and the Indy 500 all coming to town next month.
To the extent possible, we'd love to maybe test people at the Indy 500 if that was possible. Set up booths and make sure people are getting tested, make sure people are adhering to guidelines.
The Fairbanks study shows that compared to the flu, you are 6 times more likely to die from COVID-19 than you are from influenza. In downtown Indianapolis, Russ McQuaid, Fox 59 News.
The State Health Department says so far 2,666 Hoosiers have died from the virus. One national forecasting model estimates that number will jump to more than 3,300 by November 1st.